Hey, I want to welcome Kennesaw Happenings podcast. We're here at Overture 55 and older community here, right by Academy Sports and behind QT and Popeye. So in the studio, I met Donna about a couple weeks ago, and I just wanted her to come on and just share a little bit about how she's serving the community. So Donna, tell our viewers who you are, what you do, and who you serve.
Okay, well, thank you so much for having me, Pete. My name is Donna. I work at Ridgeview Institute, and we are a mental health facility located over in Smyrna, Georgia. I've actually worked there for 30 years, so I've been there a very long time. My profession is a nurse. I've always been in psychiatry and addiction. And when we opened up services for our older adults, that really took a lot of my heart. And I've been out in the senior community for probably 25 of those 30 years. I'm reaching out to seniors in all different capacities to be a resource.
I love that because Bartina and I live here. And so we kind of are more connected to our community. And I think coming out of COVID, mental health has been a challenge for us. So what would you say, like, to our viewers that all of a sudden are seeing maybe a different environment? What are you guys doing to kind of help in that transition or that area that they may be struggling?
Well, I think mental health and substance use are clearly the elephant in the living room. And there's such a community stigma, and we all kind of feel like we can handle it on our own. So opening that door and letting people know that there's help out there is the beginning, just education and support. Particularly after COVID, there was so much isolation for older adults. They were isolated from their families. Maybe not very many are involved with technology. They didn't get to see their grandkids. They have health issues. They were scared. I saw a lot of seniors come in the hospital who were suicidal and hopeless. And they had been isolated for so long that they really, really declined. And then I also saw those same people get better and find help and hope with each other, with community. So community is so important. And also feeling like whatever you're going through, there is some support and resource out there that might be able to help you.
I like that, what you just said. I'm going to just say this, but I don't know if it's true. Do you feel that you guys are the bridge from the area that somebody may be struggling in mental health, and by coming to you guys, you're helping them get to a better place wherever they are in their life?
Absolutely. We are actually the acute care step. So unfortunately, it's when people are in crisis, most often is when we actually get them.
Okay.
But once they get through their crisis, we are putting together what's the next step, whether that's an outpatient therapist, whether it's a support group, whether it's a senior community. We do have a day program. We have a half-day program. We have an evening program. So for some active seniors, those are options as well. And I've seen a lot of seniors go through those programs and get more support, not just stabilization, but true treatment, really working and talking about their feelings and what's going on with them, their struggles, their grief, the loss, the change in their functioning, the fears of the future. Retirement is a big issue for older adults. And then we also see some folks that have cognitive issues and they're having behaviors. So we stabilize those. And a lot of those folks might end up going to an assisted living or memory care. And we help the families with that, and all the resources that are out there. And it's very complicated. It takes a village. It's not just, go do this. You might need help with an elder care attorney. You might need estate planning. You might need a geriatric care manager. You might need just to be in a social environment. A lot of seniors are living alone. And they're sitting alone and they're watching TV all day and nobody's calling and nobody's coming in and they're not eating well because they can't get out. Finances are a challenge. So just learning what kind of resources are available in the community for all levels, from somebody that is scraping by to somebody that's pretty well off and, they want to enhance their life and have friendships. And what's so interesting is we have a very active alumni on our campus. And a lot of them are our seniors because they went from kind of being lost souls to having fellowship, purpose, friendship, and they have the time to donate and do service work. So now they have an importance, and they actually do a lot of service work in our community together. They go hiking. I have a 79-year-old senior who came in who wanted to put a gun in his mouth. He was hopeless and helpless.
Wow.
And so close. Life was falling apart. And now, 4 years later, he still comes back every week for a support group. He's very active in our alumni, creates all kind of sub-mini activities. They all get together. They have fun. He's like, my life is so full now. He goes, and I see my grandkids and I see my family and I'm doing this and I'm doing that. And like, wow, what a difference.
Yeah.
What a difference. So there is a lot out there. It's just trying to figure out what somebody needs and how to make the right connections.
Yeah, that I love that you just share with our viewers that story, because the challenge of being isolated definitely was affected in COVID. And even after COVID, we have a community manager that's awesome. And she was on our podcast yesterday. And what we're trying to encourage our residents is be a part of the community, to engage. Just be engage. Just to be in your room isolated will eventually deteriorate your mental health, because we see it firsthand. So what would you say, like being your 30 plus years, involved in this community, have you seen anything like in the last 10 years or the last couple years? I know we can speak to the COVID. Did you see anything in your journey of 30 years that things started to get a little wacky, or that you could see, wow, it's gotten worse than it was last year?
I think we see at our facility a higher acuity across the board, all ages. And that's even more recent. On a good note, though, for the senior community, when I first started, there was nothing out there. I remember the first time the idea of an assisted living came out, and my boss says, I don't think it'll be anything, but go ahead, check it out. Oh my God, now there's an assisted living on just about every corner in the county. The challenge is the cost of all of these services. And there are a lot of wonderful services that are free or low cost, but there is a gap. There's definitely a gap financially, but between what's available and some of the higher end. There's a housing challenge. I do a lot of in-services over at the Cobb community centers for the seniors, and some of them are just eking by. They come because they get a free granola bar. That's how limiting their life might be because of finances.
Right.
And that just breaks my heart that there's not more services for that.
Right.
But I also see there's more mobile physicians, there's mobile nurse practitioners, people that will come to the homes, Meals on Wheels. There's even programs for people that have pets and need pet food and need Meals on Wheels for their pets, There's something called Neighbor Force, where neighbors will get together and help seniors in a community for a small fee, helping out. There's some lady started a program where she'll call a senior every day and just talk with them. And the family will pay a small, very minor, like $5 a month fee, just to have that somebody to talk to every day, somebody to check on you every day. In facilities like this, sometimes they'll have a situation where people will have a check-in, and they have a system on the door where if you're not up and about, you don't change the sign on your door so somebody knows, wait a second, something's not right. They haven't turned their sign around yet. So let's go check on them. Just checks and balances, caring about somebody else.
Yeah, I can relate to that personally, because before I came here, I was in a 55 and older community, and a person passed away, and it was 3 or 4 days before they knew. Because, if you don't have a checks and balances or a way to, find out if anything's wrong, because if you're alone and something happens, unless you have some way where people I like that idea of calling or letting people know that you're okay, Because, my mom's 94 and she lives by herself. And so we have cameras in there
Sure.
just to keep an eye on her regular routine. She's still independent living, but she fell, she got COVID. So things start to change as you get later, a little older in life, and you have to do these things.
Right.
So what would you like for our viewers out there? I love that you say there's resources. I would love, what are the top couple resources that you find in your position that you're saying, oh, you got to do this. You got to hear this is available that our viewers might not know is available.
Well, I think, first of all, staying physically active is really important. Mentally active is important. Spiritually active is important. And if there's a way to connect, even sometimes people are connecting like this online. If you have ability, we're in a shifting generation. Some folks are like, I don't even have a phone that I could do. Like, you can actually do telehealth now with a lot of services. You can do some support groups on telehealth. So those are some options. There are mobile people that can come out to your home and do some therapy. Get connected with the community senior services, because there's a lot of opportunity, education, activities, groups, Meals on Wheels. There's day centers. So there is some support for those folks, and that's low cost. I think the biggest thing is connection and feeling like we have somebody else in the world that cares about us.
Yes.
And somebody that's checking in, just like you said. So if something happens, we have somebody we can call. So having that support system, being really careful with medications. As we get older, we tend to get on more and more medications. And sometimes what happens, we get a little forgetful, wake up and like, did I take my meds? I'm not sure if I did or not. So you take them again. And then by noon, you've doubled your blood pressure medication and you're falling, and nobody knows. So there's a lot of risk. I think one of the risks for seniors too is we go to a lot of different doctors. And this doctor doesn't talk to the other doctor, who doesn't talk to the third doctor. And then we're getting meds at different pharmacies. So I would say stick with one pharmacy. The doctors don't take a lot of time. They don't have a lot of time. So we have to have an advocate, whether it's ourselves or a loved one or a neighbor, an advocate that can really make sure that we're getting all our meds from the same place. I've seen seniors come in, they got put on a medication at an ER, and it was meant to be short-term, and they've been on it now for years. And there's like no way they should still be taking all of that. Or they're taking a generic and a brand, but because they're getting them at two separate pharmacies that aren't connected, they're doubling what they should be taking. And as we get older, our body changes too. We might not always need to be on an adult dose. We almost need to be on a children's dose, because our body size might be smaller, our absorption has changed, our metabolism has changed. So the dosing needs to also change. Our activity level, our absorption. So a lot of seniors get into trouble with a lot of medications. So ask the questions, have a list of what you're taking. There's something called the Beers criteria, BEERS, just like the drink. But you can go on the internet if you're savvy with the internet and look up medications. It's about 30 medications that are challenging for seniors, that are at risk. And then you can click on it and see what it shouldn't interact with or what it can interact with, what to be careful for. And just reviewing all the medications you're on, getting on the least amount as possible, because some people really get into trouble with medications, and it's just, they're just listening to their doctor. They don't know. So I see medication high risk. Be really, really careful with drinking. As we get older as well, the absorption changes. So that 5 o'clock, I always used to be able to have a glass of wine. Suddenly, because of boredom and isolation, they're often drinking earlier. They can't handle it. It goes straight into their bloodstream. It doesn't get metabolized as quickly. And then we find seniors are falling, and we're not sure why. And, you look at it, and that's substance abuse isn't necessary. It's not an excuse, and it's a disease process that can get us into trouble. And if we can catch it early, people can get healthy and get well and not be putting their body at risk. And alcohol interacts with all these medications. So it's just a safer thing not to really drink anymore. Put that aside or keep it very low level.
I was in Shepherd for 39 days, and I had a relationship with my my speech path. She was about not my age, but she was older. Some of them are a little younger than that. And so the doctor said, no alcohol for a year. And I was going like, are you serious?
Yeah.
And so I asked her, I go, what's with that? I got to not drink alcohol for a year. And she goes, yes. So I was like, I'm not a big drinker. I'm a social. I play golf and like a beer afterwards. So, but here's what I discovered. I did not, after that year, I went back to my regular routine. Now, I was on Adderall. I was on other medications, and there was problems. And I didn't realize, I always thought because you drink alcohol, you got that liver issue. But then I started online seeing the brain issue. The alcohol goes right to the brain. My functionality, since I don't drink alcohol anymore, is off the chain good. But the clarity. So I just shifted by and looking online and just researching, just hearing videos and people talking about what you just said. The interaction with medications. I mean, it's not like the alcohol companies think, well, if you're taking this medication and this medication and this medication, you shouldn't drink it. It's just, it is what it is. We're responsible for ourselves to do that. So I do like you that you brought that up, because I think it's really important to know how our body assimilates things. And as you write, you change in time. And so one point I would like to just bring you back to, that one pharmacy issue. I mean, it's so important, because a doctor's not going to say, well, tell me all the different medications that you take from every pharmacy that you, I mean, they don't have time to research all that. Yeah. So there's a premium on time. So you have to take that responsibility and saying, okay, I don't need to be going to 3 different pharmacies, because there's no interaction between those, and they can't tell. I like that beers. So we'll put that in the show notes so people can really understand that there are medications that conflict with medications, and your body's different than that other person's body. So I love that you've brought to our viewers that. So what would you say? Like, I always love hearing like 30 years of experience. Wow, that's incredible. So let's take our viewers to, but you have all that experience and you're coming to the community with the resources. What would you say to people that, mainly kids, that they know their mom and dad, and there is a stigma to the mental health. You say mental health and people just, they don't know how to react. So how would you encourage our younger, like kids my age that have aging parents, that maybe, what signs would they need to be looking for in their parents that they need to reach out to somebody like yourself?
So many symptoms are related to being older, and very often they can be a problem. So it is hard to decipher what's going on. Certainly start watching for any short-term memory. That's the first thing with cognitive impairments and early, like Alzheimer's and things like that. If you start seeing like short-term memory issues, forgetfulness, some forgetfulness we all have. And if you can retrace your steps and come back and find the answer, like within a short amount of time, a few hours, like, okay, that's not terrible. But if it starts getting more and more and more and more, you start noticing. Be aware of that. Certainly, a lot of seniors will not talk about their feeling, but they'll talk about it more somatically. Like, I don't want to go because I'm ached and my stomach hurts. And so you hear more physical complaints, and they might not always be related to their medical situation. And it's maybe more of a anxiety or depression going on. Sometimes depression can look very agitated in an older adult.
Okay.
People think, oh, depression, you have to be curled in bed and crying all the time. Well, no. It could be somebody agitated. Because people are living longer and we're seeing more now, there's late onset depression, there's late onset bipolar disorder. So sometimes things that we were able to manage when we were a little younger get harder to manage as we get older. So, sleep disturbances, you start getting out of pattern with sleep. That doesn't mean you have a disease process going on, but you might need some help getting that reestablished, because that can throw you off. I know for me, I don't have a good night's sleep, I'm pretty cranky the next day.
Right.
And what happens, I think, with a lot of older adults, they don't sleep well, then they get up late. Well, then they might take a nap, and then they can't sleep again because they napped. And then before you know it, their whole sleep cycle's turned around. They might have difficulty falling asleep or difficulty staying asleep, and it just throws them off. And that can lead to, a more challenging episode. Hydration is probably the number one thing we all need to do.
Right.
We do not stay hydrated. I see so many seniors come into the ER and they actually are psychotic. And it's because they're dehydrated and they're brewing maybe a urinary tract infection. We're very susceptible as we get older. So drink water, move around, exercise a little. Even if it's not major, you can do some chair stretches, chair movements, walk around your apartment a little bit, whatever you're able to do, but stay active. And drink a lot of water. Those are the two most important things.
I love that. I love that you said that, Donna, because just this morning I'm downstairs and there's 2 flavored lemon water jugs that Josette put in.
Yeah.
And, and I think it's important because I heard a number, whether it's exactly right, that our brain is 73% water. So if we're going immediately to the cappuccino as our choice drink, of course, that's sugar and it's not caffeine. So now they have a choice here at Overture of getting refreshing, cold lemon flavored, because it has, lemons in it. I told Clarissa, I said, this is good, because I'll even come down in between my podcasts and get this type of water because I can't cut up lemons like I used to. So I've missed that part of the flavoring of water, because I drink water all the time, but I'll drink it the first 4 or 5 hours of the day. And I find that I don't drink it later. So yes, I want to encourage our seniors, take advantage of this flavored water right in our lobby and drink more, because that is true. The dehydration
it's really, really, really important. Whatever your weight is, kind of generally take that in half, and that many ounces you should have a day.
Okay.
As an average kind of guess.
That is
and
awesome.
The lemon or the limes in it and the fruit, the citrus in that is good for your kidneys also.
Okay.
So that helps not form kidney stones.
Awesome. Well, Donna, I want to be respectful of your time, and I appreciate you being a guest on our podcast. How can people get a hold of you?
If anyone is in a crisis, Ritchie is open 24 hours a day. Anybody can walk in. And they can also call and come in and have a free assessment. We do work with Medicare and all the managed Medicaid plans. We cannot accept straight Medicaid. Only a medical hospital can do that, or a medical psych. So we're open. Our main number for intake, or our main number at the hospital, is 770-434-4567. Pretty easy to remember.
Awesome.
So we are available. And that's available for any age group. Actually, we have services for 12-year-olds all the way on up to seniors.
Awesome.
So you may have an adult child. You're the senior listening to this, and you're like, my child who's 50 or 40 or something is having some issues, or my grandchild's having some issues. No, we do have services for all those age groups. We have a lot of support groups. They're all in person at this point, and we do have one telehealth program. So that's a psych program in the mornings. People can log in and actually have treatment via telehealth. So we are open and available, and we can put my work cell phone number too up on the podcast. If you like, if anybody has a question or just wants some resources, I'd be more than happy to help anybody.
Well, we appreciate your servant heart and really serving our community with something that's so important. So for our people that are driving, we want you to focus on your driving. Don't be jotting down something while you're driving. We'll put it in the show notes, everything that Donna talked about. That way you can go to it. And I want to encourage you to share this with people that you think can be served by the resources now that are out there. Because you said it, Donna, we don't often know what our resources are. We operate sometimes in these silos, and we have no idea that there's help out there until somebody like yourself shares, that there is help. There is support out there. I love that alumni, concept of the support that you all have there. So what would you like, as we always like to ask our guests, what would you like our listeners to take home from this podcast? The number one thing that you would want them to know?
Not be afraid of getting help. Mental health is not a sign of weakness, and there is help out there at all levels. So if you're struggling or you're feeling lost, reach out. Absolutely reach out. We can hook you up with a therapist or a support system, or get involved in some things that might be added. Go out, reach out to a neighbor. Service work for all of us gets us outside of ourselves.
Yes.
When we're not feeling well. So if we can do something for someone else, that comes back to us, and that's a wonderful opportunity to reach out to someone else. Call people. Reach out, knock on your neighbor's door, take a little more interest. Because this is a valuable time of our life, and you want to stay as active for as long as possible.
Awesome. Thank you so much, Donna, for sharing that and being with us and being able to share with our community, what resources are out there, and just encourage our viewers to share this. If you know people that you think this would serve, share this episode with them and let them know that there is support and help out there in the county. All right. Thank you, Donna.
Thank you.